Good morning. We have quorum. We'll begin. My name is Councillor Alejandra Bravo, and I'm Vice Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I'll call meeting 12 of the Board of Health to order. Welcome, everyone. Today's meeting is being held with board members and city staff participating both by video conference and in person at City Hall in Committee Room 1. City Hall is open to the public, and anyone is welcome to attend the meeting at City Hall today. The public may continue to participate electronically by video conference. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. I will ask everyone for their patience with any delays and technical issues. The clerk's staff will connect all remote registered public speakers to the meeting by audio. The list of speakers can be viewed online by visiting the Board of Health's page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has also emailed the speakers list to directors. Directors, this is a paperless meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute your mic if you wish to question staff or speak. I will then create a speakers list and will call on directors when it is your turn to speak. When voting on an item or a motion, I ask that directors please ensure that you turn on your video and raise your hand to indicate your vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. I want to acknowledge the land that we're on and recognize that this is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, Haudenosaunee, and Wendat peoples, and is home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and one important thing to remember in this land acknowledgement is that how it informs the way we work together in this committee is with a reciprocity and respecting relationships. I also want to acknowledge, as the City of Toronto does, that all treaty peoples, including those who came here as settlers, as migrants, either in this generation or in generations past, and those among us who came here involuntarily, particularly those people brought to these lands forcefully as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent and commit to confronting anti-Black racism. Are there any declarations of interest under the Municipal Code of Interest Act? No, seeing none. Next, we need a motion to confirm the minutes from our last board meeting on March 25th, 2024. Director Zoot, all in favor? Opposed? That's carried. Let's see. And I will just speak briefly now with opening remarks. This month, we are raising awareness for several issues that intersect with our work here at the board and in public health more broadly. April is Oral Health Awareness Month, a time to remember the importance of maintaining good oral health as vital to maintaining overall health. I'm proud of the work of Toronto Public Health's dental teams, providing free dental care for eligible clients at 20 active clinics across Toronto. This includes a new free mobile dental care program for more than 2,600 residents of the 10 long-term care homes operated by the City of Toronto, announced last week in partnership with the Government of Ontario. April is also Be a Donor Month, reminding us all to give the life-saving gift of organ and tissue donation. You can become a donor by visiting www.beadonor.ca. This month is also Refugee Rights Awareness Month. In April, we remember the April 1985 Supreme Court decision, which recognized the rights of refugee claimants to fair and equal treatment under the law in Canada. Every day, refugees choose to make Toronto their new home. It is our ongoing work to ensure that refugees are safe, welcome, and healthy in our city. We're also coming to the end of National Immunization Awareness Week, an opportunity to highlight the effectiveness of immunization and immunization's role as an act of care and solidarity with our community. This year's theme, Protect Your Future, Get Immunized, highlights the importance of staying up to date with recommended vaccinations so everyone has the chance to live healthier lives free from vaccine-preventable diseases. I would like to mention the ongoing work of Toronto Public Health in response against measles. Since our board's discussion of the emerging trends in measles transmission last month, Toronto Public Health has implemented new public communications, updated resources for the public and health professionals, and provided countless MMR vaccines at Toronto Public Health clinics across our city. A huge thanks and props to the Toronto Public Health staff who have made this happen. Secondly, I had the pleasure of chairing the third meeting of our Board of Health Strategic Plan Development Committee last week, with thanks to committee members, Director Chandrabalan, Director Suskanda Raja, and Deputy Mayor Morley for their ongoing work to shape a strategic plan that responds to the current moment and reflects the responsibilities we hold to protect and promote health in our city. The committee reviewed feedback received through the public consultation process from 1,378 individuals and more than 70 organizations, and based on the recommendations of staff, has brought forward an emerging plan for a review today. I'm looking forward to getting your feedback on it when we review at the end of today's agenda. Speaking of which, we've got a full agenda ahead of us. Our discussion will also encompass a few financial related items and a report to receive external funds for the 2024 budget year. For Partnership for Healthy Cities. We will also review the operating and capital budgets for last year's budget and receive the 2024 operational and capital budgets that were approved by Toronto City Council in February. We will also review a letter from Councillor Moyes, our chair, requesting a report back on Toronto Public Health's role in preventing cancer at a population level. This is an important response to data found in the 2023 population health profile. I'm looking forward to our discussions today. And on a more personal level, I think we're all going to be holding today the tremendous news that Althea Hutchinson will be moving to this Chief Financial Officer's office. I believe the Medical Officer of Health will speak more about that, but I can say from my point of view that Althea has been a treasure at Toronto Public Health, a treasure for directors to understand the budgets, both operating and capital. And I am very pleased as a city councillor that Althea will be contributing her tremendous talents to the City of Toronto at this level. And even though it is a tremendous loss for Toronto Public Health, I know that there will be a champion forever for Toronto Public Health and Althea. I believe that now we are going to go to the Medical Officer of Health before we review the agenda.
Thank you, Vice Chair Bravo, and good morning, members of the Board of Health, staff, and guests, both those of you who are here in City Hall and those of you who are joining us remotely. As Vice Chair Bravo has highlighted, our agenda today does encompass a wide spectrum of commitments to public health. From financial management to forward-thinking strategic planning, these endeavors are all geared towards enhancing the health and well-being of the community we serve. As we know, public health is the cornerstone of a thriving city. It's the silent gardening that creates the conditions and the environments that allow for healthy communities to thrive and to prosper. And while most may not be aware that it's happening, public health is constantly and continually preventing and responding to outbreaks. We did hear a little bit about that from our Vice Chair this morning. Promoting healthy behaviors across the lifespan to prevent chronic disease, ensuring safe food and water, and working with policymakers to reduce the sources of health inequity. And that's just to name a few of the activities in which we're engaged. Public health truly touches every aspect of our lives. And yet the work we do often goes unnoticed until there's a challenge. Therefore, today's TPH strategic planning discussion is critical. And as you just heard from the Vice Chair, the board will receive an update on that plan during this meeting. The plan is about charting a course for a healthier future for all Torontonians. It's a roadmap that will guide our collective efforts in tackling pressing issues like chronic diseases, mental health, and health disparities. By aligning with the Ontario Public Health Standards and incorporating public health best practices and considering input from our communities, this plan will ensure that we're focusing on the right initiatives and measuring their impact on the health of our diverse population. Finally, I do want to extend an invitation to all present at today's Board of Health meeting to join us for the upcoming Toronto Public Health event, Diverse Dialogues, Stigma and Breaking Barriers, which is a part of the Charles Hastings Lecture Series. So it's occurring this Wednesday, May the 1st at 6 p.m. And in this session, we'll be delving into how stigma can affect health decisions and the role that the social determinants of health play and practical ways to create a more inclusive city. At the event, we're honored to be joined by Dr. James Makokis, Dr. Natisha Masakwa, and Michelle Rodriguez as distinguished speakers. Tickets are still available online through Eventbrite, and a number of colleagues here around the room can certainly point you in the right direction should you be interested in attending. And then last but not least, if the board will indulge me for just a few moments. You've just heard from Vice Chair Bravo of the news that frankly strikes mixed emotions amongst all of us at Toronto Public Health, and particularly me. We have heard, courtesy of Vice Chair Bravo, that Althea Hutchinson will be leaving Toronto Public Health towards the end of May to take on the role of Executive Director of the Financial Planning Division here at the City of Toronto. I'm going to try to get through this without getting too emotional. Althea joined Toronto Public Health in November 2017 as the Director for our Finance and Administration Directorate. And to put it mildly, she has taken on countless responsibilities and files on since then. The Emergency Planning and Performance Management Team, the Student Nutrition Program, the Toronto Urban Health Fund, and recently, in the last few years, leadership of a multidisciplinary team that was pivotal in recruiting hundreds, and I do mean hundreds of staff, and procuring other resources and supplies throughout our COVID-19 response. And this was all done mostly with a smile, mostly with a smile, and in record time. I could go on and on if we had hours to spend, but I do want to be respectful of the board's time. So I will simply summarize it this way, as I did to a message to all staff, as we learned of Althea's new opportunity. Althea is highly skilled. She is thoughtful. She is passionate and compassionate. She is people-centered and principled. She is a true professional in every sense of the word, and a role model for all of us who work in the public service. And while we are absolutely thrilled for her, I know you can't tell by the way I'm speaking, but we are absolutely thrilled for her and the new opportunity that lies ahead for her, we will miss her terribly, and her absence will be deeply felt. But with that in mind, and with the opportunity that's in front of her, I would just ask that all of us, board members, those of you who are here in the room, please join me in thanking Althea for her contributions to Toronto Public Health and congratulating her as she moves on to her new role in the Financial Planning Division, where I know that she will shine, as she has done so here at Toronto Public Health for the last 7 years. Congratulations, Althea.
letter, this item is a letter from the Board of Health Strategic Plan Development Committee, which met last Wednesday, April 24th. I'll ask the Board Secretary to display the item. So I'd like to, oh, it's okay. You can see the motion displayed. It's set, yeah. So all, directors, you've seen the motion. All in favor? To add it to the agenda, opposed? That is carried. Thank you. So let's go on to the agenda. Item HL 12.1, Partnership for Healthy Cities, seeking authority to receive external funds for the 2024 budget year. Would anyone like to hold this item? No. So I move, Deputy Mayor Morley would like to move the staff recommendations. All in favor? Opposed? That is carried. Item HL 12.2, City Approved Toronto Budget Health 2024 Operating Budget. Would anyone like to hold this item? No. Would anyone like to move these recommendations? Director Zhu would like to move the staff recommendations. All in favor? Opposed? That's carried. Item HL 12.3, City Approved Toronto Public Health 2024 Capital Budget and 2025-2023 Capital Plan. Would anyone like to hold this item? A mover? Deputy Mayor Morley. All in favor? Opposed? That's carried. Item HL 12.4, Toronto Public Health Operating Budget for the year ending on December 31, 2023. Would anyone like to hold this item? No. Would anyone like to move the item? Director Zhu, all in favor? Opposed? That's carried. HL 12.5, Toronto Public Health Capital Budget for the year ending on December 31, 2023. Would anyone like to hold this item? No, I will move that then. All in favor? Opposed? That's carried. Item HL 12.6, Toronto Public Health's role in preventing and addressing cancer in Toronto. There are registered public speakers, so this will be held in my name. And then we've added, now we've added HL 12.7, and we have a presentation for that. So we will now go to HL 12.6, Public Health's role in preventing and addressing cancer in Toronto. And I'm going to call speakers. The first speaker is Anne Wordsworth. Sorry.
Okay, I think, can you hear me all right? Is this?
Before you begin, I'll just explain that the debutants, there are 3 debutants who are going to share 15 minutes, which is 5 minutes per debutant, as our procedures allow. And so I will be, if you're online and you see 15 minutes, this is because there are 3 speakers sharing 15 minutes. And for those present, welcome to the committee. And as I said, you have 15 minutes together. You may begin.
Okay, is my microphone on? Okay. All right, good morning. I'm Ann Wordsworth. I'm the chair of the Toronto Cancer Prevention Coalition. And I'm here on behalf of the coalition to talk to you today about our work on cancer prevention and to talk about our engagement with the City of Toronto on this important issue. We want to thank you for the opportunity to come and reacquaint ourselves with some of the people that know our work and to introduce ourselves to people who may not have seen us here at the Board of Health before. So the Toronto Cancer Prevention Coalition was established in 1998 with the support of the Board of Health, and in order to contribute to the work on health promotion and chronic disease prevention. Our mandate is to reduce the incidence of cancer in the City of Toronto and support the City of Toronto through the Board of Health and other agencies, boards, and commissions in our work to actively prevent cancer. Cancer remains a very important issue today, responsible for 30% of the deaths in Canada. And I would draw your attention to the newspaper report in the Globe on Friday, which discusses the fact that younger people are being affected by cancer. The incidence of cancer is on the rise for younger people in a lot of developed countries. And 2 of the risk factors are alcohol and exposure to chemicals and pollutants. So these are exactly the topics that we've been working on for the last 25 years, and we continue to work on. So the 3 groups that make up our coalition are the Alcohol Working Group, the Environmental and Occupational Carcinogens Working Group, and the Ultraviolet Radiation Working Group and its Shade Policy Subcommittee. So each of these groups focuses on a specific aspect of cancer and methods of reducing the risk. So we have 2 of the 3 groups here today, and I'm gonna ask them to discuss their work and kind of what they've done. So first of all, I'd like to introduce Ellen Simmons. She's the co-chair of the Environmental and Occupational Carcinogens Working Group, and she's a communication officer for the Workers' Health and Safety Center.
Good morning. Thank you, Ann. Environmental and workplace carcinogens are significant contributors to our cancer burden, yet cancer prevention efforts largely still focus on individual modifiable risk factors: smoking, diet, lack of exercise, and yet studies estimate that environmental carcinogens may be responsible for 2 to as much as 19% of new cancer cases. According to a 2016 report by Toronto Public Health and Cancer Cure Ontario, solar UV radiation, radon, and fine particulate matter account for 90% of environmental cancer cases in Ontario each year. A 2014 report by Toronto Public Health also talked about the links between, air pollution and premature deaths and hospitalizations in the city, with fine particulate matter being a significant contributor. Work is still too often overlooked as a social determinant of health. And yet we know that in Ontario, occupational cancers claim more worker lives than traumatic injuries. A 2017, burden of occupational cancer in Ontario report by the Occupational Cancer Research Centre and Cancer Care Ontario concluded that the role of occupational carcinogens is substantial, with exposure to UV radiation, asbestos, diesel engine exhaust, and crystalline silica being significant contributors. In Ontario, for instance, 450,000 workers are exposed to solar UV radiation, and this causes an estimated 1,400 non-melanoma skin cancers every year. Far fewer are exposed to asbestos, only 55,000, but it still results in about 790 cancers every year. So identifying exposures in the workplace is critical because most of these exposures can be prevented. So to this end, much of our work for decades involved trying to get and successfully securing the city's environmental reporting and disclosure bylaw. We think with greater transparency and knowledge, we can control toxins at source and reduce the burden of cancer for workers and the community. This is why we fought for the bylaw decades ago. Passed in 2008 and the first of its kind in Canada, the bylaw requires businesses to track and report the manufacture, use, and release of 25 priority chemicals of concern. Implemented through ChemTrack, this data gives communities information on sources of pollution and helps them engage with workers and businesses to reduce the release of toxins. And it's not just what's being released, it's also where these things are being released. You might be interested to know that 27% of reporting facilities are in areas of the city where more than 30% of the residents are below the low-income measure. So this is very much an equity issue as well. Through Live Green Toronto ChemTrack grants, we've done our part to raise awareness of this community right to know bylaw by creating a Toronto Toxic Reduction Toolkit and also a guide to non-toxic dry cleaning to raise awareness of chemicals and toxic-free alternatives. But there's much more work to do. We contribute to cancer prevention by increasing our knowledge and that of the public about carcinogens and how to reduce them, and we're eager to work with others who share our mission. To this end, we encourage the city to utilize, enforce, and strengthen existing regulatory tools in aid of cancer prevention. We think a good place to start would be to reinstate the ChemTrack program, which has been paused since May of 2020. Through our coalition, the city has adopted a framework for the primary prevention of cancer, and if it was applied more broadly across all city departments and programs, we believe it would help bolster the city's cancer prevention efforts. We also support the establishment of a registry of city buildings containing asbestos to identify where this carcinogen is present to reduce the health risk for members of the public and workers engaged in maintenance and repair of these structures. Leveraging the city's idling bylaw and continued electrification of public transportation can further reduce emissions from cancer-causing pollutants, and this would also help the city meet its Transform TO net zero strategy goals. So we thank you for your time, and we look forward to leadership by the Board of Health and Toronto Public Health to address environmental and occupational factors in the prevention of cancer in the City of Toronto.
I'd like to now turn it over to Norman Giesbrecht from the Alcohol Working Group.
Thank you. Alcohol is a contributor to a wide range of trauma, social problems, and chronic diseases, including cancer. In Canada, annually, there are an estimated 17,000 deaths associated with alcohol use and many more injuries and illnesses. Even at low levels of consumption, there's a risk of developing cancer related to alcohol use. Next slide. In 1988, which is almost 30 years ago, the alcohol was declared a Group 1 carcinogen, similar to tobacco, by the World Health Organization. As shown on this slide, alcohol has been linked with several types of cancer. Researchers associated with the University of Victoria and the Canadian Centre on Substance Use have estimated 7,000 annual cancer deaths associated with alcohol use in Canada. Next slide. What can be done to reduce the risk? Our group proposes 3 specific interventions. First, with regard to alcohol consumption. Just over a year ago, the Canadian Centre on Substance Use, in collaboration with researchers from several Canadian centres, released the Canadian Guidance on Alcohol and Health. As shown, risk is associated with the amount consumed. We recommend that the City of Toronto endorse this document and promote it on their website. Next slide. The second question is of labeling. Here's a picture of the labels on alcohol beverage bottles warning of the cancer risk. This was research done by Dr. Aaron Hoban, Public Health Ontario, and colleagues. Used this label in White House liquor outlets, whereas in Yellowknife there were no labels on such bottles. As a result, the researchers found an increased awareness of alcohol as a carcinogen, the reduction of alcohol consumption, a greater support for effective alcohol policies. A committee of the Canadian Senate is currently considering a bill to enhance warning labels on alcohol containers with alcohol risk. We are asking that the Board of Health indicate their support for the proposed legislation, Bill S-254, to add warning labels on alcohol beverages. Next slide. Third is the subject of alcohol advertising. We draw your attention to the extensive alcohol marketing on TTC vehicles, platforms, and transit shelters. New York City has discontinued alcohol advertising on their transit systems. These ads are seen every day by school children, abstainers, and those dependent on alcohol. Therefore, they promote the consumption of this carcinogen, and we recommend that alcohol advertising be discontinued on TTC vehicles, platforms, and stations. Thank you.
Okay, thanks, Norman. The third working group is the Ultraviolet Radiation Working Group and Shade Policy Committee, chaired by George Capellos, who is unfortunately out of the country right now. And I'm going to try and briefly kind of represent the work of their group. So he is an architect and urban planner at Toronto Metropolitan University, and his committee is made up of architects, landscape architects, urban designers, parks planners, foresters, childcare workers, and dermatologists. As Ellen has pointed out, a 2016 report by Public Health Ontario and Cancer Care Ontario identified solar UVR ultraviolet radiation as an environmental carcinogen, and ultraviolet radiation, as most people would know, causes skin cancer. So early exposure to UVR can cause cancer later in life for people. So protecting children is an important part of the mandate of the ultraviolet radiation group. Seeking shade is recommended as one of the primary protective actions that people can take. So the UVR working group has focused on shade as their main activity for cancer prevention. They have focused on policy and on-the-ground implementation, and they were instrumental in helping the Board of Health develop the 2007 shade policy. This is has made Toronto a leader in the development of shade for skin cancer prevention. And basically, the shade policy just says the provision of shade can be an effective means of reducing exposure to ultraviolet radiation and its associated health risks such as skin cancer. So with this mandate, with public health, the Ultraviolet Radiation Committee developed guidelines and standards and effectively worked through a number of city departments to encourage the implementation of protective shade throughout the city. In 2018, together with Toronto Public Health, the Ultraviolet Committee began a review of the effectiveness of shade policy and the guidelines. However, as a result of the pandemic, this activity was put on hold, and George and his committee believe it's time to take up this review and to complete it.
Minute.
Okay, all right. So I think that actually gives you an idea of the work of the 3 different committees. I would thank you for your time and this opportunity to speak to you. We look forward to continuing the relationship with the Board of Health. And in the past 25 years, we have had active participation and help from Toronto Public Health and the Board of Health. And part of our purpose in being here today is to reactivate the relationship that we've had and to get on with the business of cancer prevention. We have currently a member of the Toronto Public Health staff on as a liaison between our coalition and the city, but we have previously had someone from Toronto Public Health part-time supporting our committee, and I think part of our purpose in being here today is hopefully to kind of reinstate some of that support that we've had. So thank you very much for listening to us. I hope that sheds some light on the work that we've done, and we look forward to future discussions.
Thank you very much. Are there any questions of the deputants? No. Seeing none, thank you very much for joining us today at committee. And I will just remind members that there will be a report coming in October on this topic for the Board of Health to review. Thank you. And now we're going on to HL 12.7, Toronto. Oh, I'm sorry, we have one more speaker. Elena Bonilla is online. Pardon? Oh, you have questions of staff? Yeah, but after. Yeah, thank you. Elena Bonilla. She's online. Okay, welcome, Elena. You have 5 minutes. We're just holding. Elena, you are muted. Can you please unmute?
Oh, yes, thank you. Sorry about that.
You have 5 minutes.
Thank you. My objective today is to summarize the trend of cancer incidence and mortality in Toronto to help looking at how to address cancer in 2024. I accessed and reviewed official reports and publications on cancer that are available to the public, issued by the City of Toronto Public Health, Ontario Health, and Statistics Canada. Since the focus is on how to address cancer in 2024, I tried to access actual data on cancer until 2023, along with findings on the impact of the pandemic. The findings of the Toronto Population Health Profile Report issued in 2023 include cancer, diabetes, and cardiovascular disease are leading contributors to death and disability. Risk factors of an increase in chronic diseases were overdue health screens, rising of household costs, especially food, growing proportion of seniors. Actual data shown on cancer in Toronto was up to 2013, and more up-to-date information contained in the report were from Ontario Health. Actual data of cancer presented by Ontario Health was up to 2018. Ontario Health stated, this edition of the report includes data from 1984 to 2018. The projected statistics afterwards do not account for the pandemic effects. As a result, the more recent cancer data I used for analysis is the Ontario Cancer Statistics Report for 2022 with actual data up to 2018 without projections. Detailed data on cancer in Canada started being monitored in 1984, which is 34 years of recording up to 2018. It provides an excellent reliable reference for analysis of the impact of COVID-19 and the vaccinations when the actual data for 2019 to 2023 become available. Based on data analysis up to 2018, on average, cancer incidence has become stable. In terms of mortality trend, there is a reduction in the number of cancer deaths, with the exception of those under age 80 and older, which remains steady. Cancer mortality by age shows 50% of deaths within the 60 to 79 years old, 36% of deaths in the 80 and older, and 14% of deaths occurred in ages less than 59. The number of deaths for the 4 most common types of cancer, which are breast, colorectal, prostate, and lung cancer, has reduced significantly. Statistics Canada produced a report entitled The Leading Causes of Death that has actual data until 2022, with the total number of deaths by cause per year. It is relevant and more up to date. This report shows that there was no increase of total deaths from 2018 to 2019, and an increase of 17% from 2019 to 2022, showing the impact of the pandemic. Total deaths from 21 to 22 increased by 7%. In this report, COVID deaths were 6% of total deaths in 2022, representing the 4th leading cause of death. Although cancer represents 25% of total deaths, its mortality trend has improved. Malignant neoplasms increased 2.5% from 2019 to 2022, but reduced by minus 0.5% between 21 and 22. On the other side, diseases of the heart, second cause of death, shows higher mortality rate. Deaths increased by 1.5% in 21, by 3.8% in 2022. Before COVID, deaths were reduced by minus 1.5%. In addition, other causes of death increased by 33% between 2019 and 2022, and by 18% between 21 and 22. Before COVID, other causes of death only increased by 3%. Unexpected deaths that occurred since 2022 are under investigation by a coroner or medical examiner, but still pending despite being important. In summary, as of 2018, cancer incidence has remained stable and the number of deaths has reduced. Based on sex, 25% of deaths are breast and prostate cancer. Based on age, about 50% of causes of death occur in the range of 60 to 79 years of age. It's important to monitor if the breakdown of deaths changed after the pandemic and the vaccine. It is relevant to focus on the vaccine impact because it was the exclusive medical treatment used even while the virus was waning. Diseases of the heart, second cause of death, is increasing and requires attention. Public health needs to give priority to get a report of unexpected deaths that are under investigation. Timely data on incidence and mortality of chronic diseases is critical in monitoring and prevention. Otherwise, any recommendation will become unsuccessful. I would like to end with a quote. Trust takes years to build, seconds to break, and forever to repair.
Thank you.
Thanks for your attention and your time.
Thank you. Are there any questions of the deputant? No, thank you for joining us at committee today. Questions of staff, Deputy Mayor Morley.
Thank you, Madam Co-Chair. I wanted to just quickly pick up on a couple of the programs that were mentioned by our previous deputants and had been paused, specifically the ChemTrack program and the shade policy review that the Cancer Coalition has been engaged in. I was just looking to staff for comment on the status of those particular programs and the involvement of important stakeholders like the Cancer Coalition and the intention on a go forward.
So why don't I take that question through the Vice Chair. The work in respect of ChemTrack, an important program, and as rightfully pointed out by our deputants this morning, it was work that did take a pause, as did many other programs over the course of the COVID-19 response. As was communicated to members of the board, I think not last week, but the week before, we are restarting the program with a plan to have it in full operation by 2025. Again, we are now at a point in our organization's operations that we're able to do that. I know that the pandemic seems like a long ago event for many, but in fact, it does take some time for us to restart programs. Given the significance of the impact. As I mentioned in my opening remarks, there are lots of things that are being done within the context of Toronto Public Health that perhaps don't get the attention of the majority of the public, but they in fact are still happening. And certainly restarting Chemtrack is one of those. So we are actively communicating with the organizations that are required to report under the bylaw and plan to have that up and running shortly, as was communicated to the board a couple of weeks ago. In respect of shade policy, our colleagues at City Planning are in fact overseeing an effort which incorporates shade policy work but goes much broader than that. It is a thermal comfort working group. Again, City Planning is the lead on this. We are a member and an active participant on the work on this front. And it is something that takes into consideration absolutely shade and heat and all the other elements that are part and parcel of this work, particularly as we respond and adapt to climate change and the circumstances that we witness more and more with each passing year. I think what's interesting about this work is that it certainly considers the human health aspects, but it goes even further, which I think is a strength of this work, in that it considers, plant life and the environment, and considers animal health as well, over and above human health, which is obviously part of the reason, or one of the main components for the reason that we're there. So I trust that addresses the question for members of the Board of Health, and know that we are actively working on that file as well.
Thank you. Are there any other questions of staff? Trustee Sriskandarajah?
Thank you, through you, Madam Chair. You might not have the data, it might be very early, but just curious, based on the presenters, the changes to the guidelines, Canada's guidelines on alcohol consumption, are we seeing any impacts? Are we seeing sort of decline in sort of alcohol abuse or things of that nature?
So through the Vice Chair, I think it is a little early to speak to that. The guidelines, the new guidelines in respect of what constitutes lower risk drinking, I believe it was just last year, if I've got that right. So that's a fairly short time frame in which to observe changes. I will say this, and we can confirm this, certainly when you look at what's being promulgated in the media and some of the work that we see in the surveys that we do of younger people, it's interesting. We are seeing less uptake of alcohol amongst younger people. I think you probably have seen reports of this in the media, and certainly business operators are feeling that as well. So I don't know that I would connect it to the guidance, but it's just something of note that I'm sure members of the board are seeing, perhaps in their personal lives and certainly through media reports as well.
Thank you.
Any other questions of staff? Councillor Thompson?
Thank you very much, Madam Chair, and good morning. Just wanted to ask, through you to Dr. Davila, the Chemtrack program, can you remind me with respect to how it actually works? I'm wondering specifically, and I'm aware of materials being sort of let into our streams and so on, and also pollutants in our air. I'm just wondering, how do we track all of that as it relates to environmental pollution as such?
So through the Vice Chair, perhaps what I can do is provide a very high-level summary. Councillor, I would suggest that we'll have a more fulsome report for you later this year on this subject, or on the cancer prevention issues. But at a high level, there is a bylaw that requires certain businesses to provide data in respect of what toxic chemicals they release. This is a part of a broader system. There are also provincial laws and regulations in place. And again, depending on the business, there are federal requirements and regulations as well. But this captures a particular subset of businesses and requires them to report on an annual basis what toxic chemicals they're releasing into the environment, as the deputants rightfully pointed out, in a framework of a right to know, the community's right to know what is actually going out into the environment. But I'd be happy to provide greater detail to you at a subsequent date. But at a high level, that's what the the ChemTrack program, or the ChemTrack program provides for.
Thank you, Madam Chair.
Thank you, Counselor. Are there any other questions of staff? Seeing none, we, I believe, just need to adopt this. Yeah, I'd like a motion to adopt the item. Deputy Mayor Morley, all in favor? Opposed? That's carried. Thank you, directors. Now we're going to move to HL 12.7, Toronto Public Health Strategic Plan, Summary of Consultation Findings and Emerging Plan. There will be a presentation by Dr. Davila.
Okay, I think we're just having the deck called up. There we go. Thank you very much, and thank you, Vice Chair, for the introduction. Last but not least on the agenda, I hope, is a brief update for the members of the Board of Health on the progress of the ongoing Strategic Plan Development Subcommittee. So by way of introduction, as you know, we are in the midst of developing a new strategic plan that will help guide our work for the next 4 years. And I've already alluded to this in my opening remarks today. Just by way of reminder, a strategic plan is a requirement under the Ontario Public Health Standards and will be designed to complement existing program and service requirements. So from the direction of the subcommittee, we employed an engagement process with members of the public, with our partners, with staff, and with other city divisions. And today, I am pleased to provide you with a brief summary of that which we heard during these consultations on the emerging strategic plan and a highlight of what the emerging strategic plan looks like. On to the next slide, very high level reminder that we are using a framework to develop the strategic plan from the Washington Nonprofits Institute. It does lay out the strategic planning process in 3 broad steps of organizing, imagining, and launching, and we are in the currently in the second phase of imagining. Next slide. So starting in February, the subcommittee has helped to guide an engagement strategy to further inform the development of the strategic plan. And on this slide, you see a depiction of the overview of engagement activities that took place. And this includes surveys, the establishment of a dedicated email address to receive input and feedback. It includes public consultations and town halls. And there were also a number of staff team meetings led by people leaders at Toronto Public Health. Our staff also met with city division partners and community partners upon request, and we did receive a number of those requests and accommodate those. So on to the next slide to give you a sense as to what we saw by way of engagement. And as mentioned by Vice Chair Bravo, we did hear from a number of people within the public. We heard from over 1,300 individuals and more than 70 organizations throughout our engagement process. With credit to the team, who I will thank later, each question in the survey, every meeting note, every email, every piece of feedback from the community conversations and meetings were open text messages, which our team very carefully read through and manually coded one by one so that we had all the themes and were able to analyze the feedback so that we could then inform the various aspects of the strategic plan. So every email, every piece of feedback, manually coded. I can't emphasize that enough, and I will thank the team now and thank them again at the end of my presentation for the work that they did to do this. It is the level of dedication that they put into this work because we recognize how significant this work is. So from all that very careful hand coding, onto the next slide is a high-level summary of what we heard. And these are articulated on this slide and on the next one following. So what did we hear was important to the people of Toronto? Well, we heard about the social determinants of health. And people also reflected that we cannot achieve population health without meeting basic needs. Basic needs like income, housing, and food security. We heard that it was important in their minds that we continue to address the impacts of COVID-19 and to promote infectious disease prevention in evidence-informed ways. This was particularly highlighted as important work for those who are most vulnerable to the impact of these diseases. We heard about the importance of advancing and continuing to advance change in the environment around us, including the walkability of our community, noise levels in our community, culture, and access to community spaces to impact population health. And we also heard about promoting healthy behaviors and protecting health across the lifespan to strengthen population health, both before when babies are born and well into the senior years. On to the next slide of what we heard. We heard feedback on ways that participants want to see us as Toronto Public Health working. There's a desire to see Toronto Public Health work in ways that are influenced by both evidence and innovation to remain responsive to community needs. We heard about a desire to see us work in ways that continue advocacy efforts, information sharing, and collaboration to expand reach and advance actions in areas that impact population health. We heard about how it's important for us to create a larger presence in our communities through engagement and public communication, similar to how Toronto Public Health was visible during the COVID-19 pandemic. We also heard about the importance of strengthening accountability and transparency mechanisms and advancing staff recovery and building a strong and representative workforce. On to the next slide. With all the feedback that we received, again, in much greater detail than the summary that I just provided, we then worked to put that feedback into the strategic plan framework using the previous vision, mission, and principles of the organization as a starting point. And on to the next slide, now to give the members of the board a high-level summary as to what we were starting to see in terms of an emerging strategic plan and what was discussed at last week's meeting through the Strategic Plan Development Subcommittee. So we consulted the subcommittee on the following emerging vision and mission, given all the feedback that was received through the various members of the public and our partners and our staff, of course. So what we have is an emerging vision of a city where all people can be healthy and thrive. Again, with an emphasis in particular here on people being at the center of the mission, or the vision, I should say. We also have an emerging mission that Toronto Public Health protects and improves health at a population level while reducing health inequities. Next slide. We also consulted with our Strategic Plan Development Subcommittee on the emerging values, as listed here on the slide. Accountable and transparent, community engaged and connected, equitable and inclusive, credible and evidence-informed, and innovative leadership. And also on this slide, on the right-hand side, we consulted on the emerging priorities for the next 4 years. And these are, again, on the right-hand side of the slide, advocate for and advance health equity by collaborating across multiple sectors and delivering public health interventions that meet community needs, to strengthen health protection, disease prevention, and emergency preparedness, to promote health across the lifespan, to promote the conditions to support positive mental health and reduce the harms of substance use, and to nurture a positive workplace culture. On to the last slide, just to give the board members a sense as to the next steps. So to support the success of the strategic plan over the next 4 years, we are currently working on developing short-term outputs and long-term outcome measurements that will be integrated into operational work plans to track and report progress on the strategic plan. In addition to finalizing these, our next steps include developing objectives that support the priorities. The plan then is to go back to the subcommittee on June the 4th to share a draft strategic plan, including key objectives for each priority, and then on the 8th of July to come back here to the Board of Health meeting with a final strategic plan and a supporting report to be shared for the board for your consideration and ideally the approval of said strategic plan. So with that, that takes me to the end of the presentation. I do want to take a moment just to say a few thank yous, as there are many that are warranted. First and foremost, to all those who provided input to our strategic planning process. Staff, partners of Toronto Public Health, and most importantly, members of the public. I also want to take a moment to thank the Strategic Plan Development Subcommittee members for your very thoughtful feedback and input, and for working with us through this process. And last but not least, thank you to the staff at Toronto Public Health who have been actively engaged in this work, right? Whether it was through hand coding, every little piece of feedback, or any of the report writing, putting things together, making sure we had all of our information and documentation well laid out for the subcommittee's consideration. You have done remarkable work. So Upala Chandrasekara, Vanessa Fletcher, Cassidy Gardner, Jen Levy. I'm going to leave it at that. I promise, Vice Chair, I will not go any further. These are, some of the key names who have been actively engaged in this work and to whom I am very, very grateful. And with that, back to you, Vice Chair Bravo.
Thank you, Dr. Davila. Before I add my, my congratulations and thanks, are there any deputants on this item? Questions of staff? Speakers. Deputy Mayor Morley.
I just want to preempt your congratulations and thanks by adding mine to the team for this great work, and to yourself, Vice Chair, for your leadership on this important initiative. It's really exciting to see this coming together, and I'm looking forward to our future discussions in June and bringing this to the public as well. It's been also exciting to see us standing up different initiatives in the spirit of the strategy with external and other division agencies, partners. And so again, just really proud to be part of this work, and major thanks to staff for your vision and leadership on this. That's all. Thanks, Madam Vice Chair.
Thank you. Any other speakers? Director Ozude.
Thank you so much, and it's really great to see this work shaping up. I know I've been on a leave of absence, so really glad to be back. So I just want to congratulate the board on this. I am curious, I know this is still prelim, the findings. Have you heard anything specific to social isolation, loneliness, and the health impacts that it's having on, communities and people? Just really curious.
So we've moved into speakers. That could be a question of staff that we can take offline, but perhaps I'll address that in my remarks. Okay, any other speakers? Okay. So thanks, everyone. I want to start by echoing the Medical Officer of Health and Deputy Mayor Morley's words. This has been really important work and a profound collaboration between board members, members of the subcommittee on the strategic planning process. And it's been a real privilege for me to chair, and the public service. And I want to echo all of the kudos for the staff who are mentioned, and I know there are many more involved. In terms of the output here, this is really a reflection of the robust engagement that was done. So the plan that's before you does a few things, the draft directions where we're headed, putting people into the plan right from the top in the vision, and then clarifying. There was a great discussion at the strategic planning subcommittee meeting about really clarifying the role of public health, both as a movement that helps to prevent harm, prevent disease, prevent negative outcomes and health inequalities, and as a partner to health care, and clarifying right at the top what that difference is. The second thing I wanted to highlight is that in our discussions, we had, I should have said also I have a motion, which is already, which you can display, please, that there was a robust discussion around the role of and the desire in the Committee for Advocacy, innovative leadership and advocacy to be front and center of how we can make sure that public health is very effective and that advocacy isn't just from public health, but from all of our partners as well. I just really wanted to highlight how important it is that we have this strategic planning process. The last time this was done was 2015, and the world has changed significantly since then. A strategic plan is a wonderful opportunity to both guide our work, make choices about where to lean in, but also to invite and include a greater number of people who see themselves implicated in this work. Partner organizations, more than 70 showing up to participate. The strategic plan subcommittee also wanted to have conversations in the community, and community members did take that up. That was a wonderful suggestion. And so we've had different points of interaction as well that are not necessarily just deputations, which can be exclusive of many voices, but also different forms of conversation, the survey, and also discussions that have taken place in person, very important, and also just the voice of staff who are delivering these services, delivering programs. So all in all, wonderful to work with this subcommittee, wonderful to work with staff, and we look forward to the iterations that are to come, because this has been a process of robust engagement. I encourage Board of Health members that have more questions or have more interest who are lean into this and talk to staff, and certainly you can direct any of your comments to me, and I can share them with staff as well. So thanks, everyone. And to just to allude to Director Ozude's point, it's really what's come out of the big consultation with all the people that have been talked about. Underneath, so the vision is the place that we want to get to, how we know that we've won or succeeded. The mission is the things that we do to get to that place that belong specifically to Toronto Public Health. And then the priorities are the areas where we will lean into in this term. And then underneath, you will see that there will be specific actions that will be attached the next time you see this. And so there's opportunities here to really lift up or to locate a lot of interest inside of the next piece of work that's coming. So on the motion, any questions of the mover? It hasn't come up yet. Yeah. Do you want to go back on screen? Yeah, because we're going to vote. Are there any other speakers on this item? I don't think they've had the chance to see it. Yeah, it was. We're going to wait for the motion to be displayed again so we can vote. On the motion, which is to ask the Medical Officer of Health to report to the June 4th, 2024 meeting of the Board of Health with a draft strategic plan that includes the vision, mission, values, and priorities that are outlined here and that you've seen in the presentation. All in favor? Opposed? That's carried. Members, that concludes our agenda for today. Thank you very much for the deputants who came, the members of the public that are watching these proceedings, the members of committee, and of course to staff. Have a wonderful day.